Free PSA refers to the prostate-specific antigen that circulates unbound to other proteins in the blood. The measurement of free PSA, along with total PSA, enhances the specificity of prostate cancer screening. Measuring free PSA aids in distinguishing between benign prostatic hyperplasia and prostate cancer. The ratio of free PSA to total PSA is a valuable indicator in assessing prostate health. Lower free PSA levels may indicate a higher likelihood of prostate cancer. Free PSA testing improves the accuracy of prostate cancer detection, reducing unnecessary biopsies. Free PSA measurement relies on specialized immunoassays to differentiate between bound and unbound PSA molecules. These immunoassays are designed to selectively detect and quantify the concentration of free PSA in a blood sample. The ability to distinguish between bound and unbound PSA is crucial for accurate diagnostic interpretation. Specialized reagents are used to ensure the accurate measurement of free PSA without interference from bound forms. The process involves a series of steps, including sample preparation, antibody binding, and signal detection. The resulting data provides valuable information for assessing prostate health and guiding clinical decisions. The free PSA percentage is calculated by dividing the free PSA value by the total PSA value. The result of the division is then multiplied by 100 to obtain the free PSA percentage. This ratio of free to total PSA is a key indicator in assessing prostate cancer risk. Lower free PSA percentages generally correlate with a higher risk of prostate cancer. Conversely, higher free PSA percentages often indicate a lower risk of prostate cancer. In prostate cancer, the proportion of free PSA is typically lower. Cancerous prostate cells produce PSA that is more likely to bind to proteins in the blood. The increased binding of PSA to proteins results in a lower proportion of free PSA in prostate cancer. Measuring the ratio of free to total PSA aids in prostate cancer detection. Benign prostatic hyperplasia, BPH, involves an increased proportion of PSA production. In BPH, a larger proportion of PSA remains unbound compared to normal conditions. The increased unbound PSA in BPH leads to a higher free PSA percentage. Free PSA, unbound to proteins, circulates more readily in the bloodstream. The ratio of free to total PSA is a clinical indicator used in BPH assessment. Elevated free PSA percentage can suggest a higher likelihood of BPH.